be a big risk to your health.
Not just today, but also at tomorrow's Eagles game. So joining us now is Surgical Director of Heart Failure at Lankenau Medical Center, Dr. Lou Samuels.
Dr. Samuels, thanks again for sticking around with us here this evening. For our Eagles fans, and really for anyone planning to be at a big outdoor event this winter where they're spending prolonged periods of time in the cold, what makes those circumstances especially risky?
Well, you know, this is a big deal in Philadelphia, the sporting atmosphere, and drinking is part of that atmosphere. And the reality is that cold weather and drinking is a potential recipe for disaster. Alcohol can vasodilate, which means that it predisposes you to becoming colder faster and not realizing it. So the more you drink, and the colder the air, the more your body is going to succumb to the elements, and you may not realize it before it's too late. And we all know in emergency rooms they'll pick up patients all the time that have succumbed to this problem because of the consumption of alcohol and cold air and not being responsible enough to dress warmly and think twice before taking another drink.
You really have to take those extra precautions. Dr. Samuels, what are the symptoms we should look for in ourselves, in our friends and family, that they've been in the cold too long?
Well, I mentioned earlier that shivering is one of the most common signs you're going to see, but an altered mental status, when you're not making decisions clearly when you were prior to that, when your reflexes are down, when you're just not responding appropriately. And there are even those who have backgrounds of asthma. The cold air can induce the asthma, which can be a very fatal situation if you're not careful. So there's a number of things that you can look for, the simplest just being shivering, but more serious ones are just altered mental status, asthmatic attacks, and even passing out from your heart just slowing down and stopping.
All right, Dr. Lou Samuels, thank you so much for your time this evening.
Thank you.
And we all know that, of course,
The Sid!